Eh, All right, welcome back to another episode of the Autonomic Dudes. Um, and it's Kyle Shannon, my great colleague, and I'm Rob Wilson and Nick Zapata. And this is, I think, episode 5. So we thought we'd do something different, revisit some of the basics today about some of the home treatments. And we're not going to use the word lifestyles because I think it's confusing. So we're going to go back to maybe about the basics, the good, back, um, um, and the ugly. So we're going to go through this. So let's talk about that.
Yeah, so the first thing I wanted to ask you guys, because I've seen with many of our patients that they do some of the stuff at home. I wanted to ask you guys, what are some at-home treatments that our patients can do, practice, and use to feel better, other than the medicine that we prescribe them?
Yeah, so I think anyone who obviously knows something about orthostatic disorders, POTS, they'll hear water, 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 salt, salt, salt. Um, and oftentimes it's hard for patients to know, well, what's the right volume of water? What's the right volume of salt? And also, why is it that you require me to do this? It doesn't necessarily make sense.
Mm.
So it's interesting. I think when I actually maybe it's I'm just getting in my own head, but ever since I started working here, I'll notice when I don't drink enough water now. Saturday mornings, I'm a little bit more notorious for having coffee, going outside, doing yard work, and I'll be bending down, standing up, and I'll start noticing, wow, I'm lightheaded. Like what in the world is this? And that's actually a natural thing. Anyone who doesn't have appropriate hydration, more often than not, will actually get lightheaded with posture change, because their blood volume is not where it needs to be. So we do recommend, hydration status as a general rule of thumb for all of our orthostatic patients, because it helps with stabilization and sodium intake, because you have to balance that, because it helps with stabilization of the blood pressure, and making sure that individuals um, uh, are avoiding that sensation of lightheadedness and dizziness. It's not going to cure the issue, but it will certainly help kind of alleviate some of the symptoms. But it's not curing the issue at hand. Isn't that you? Why do you tell patients, Rob, to make sure that they hydrate well?
Yeah, I think it's a good point. I was listening to you, Kyle, and I was reading what Nick was working on over the last day, and old Nick's good detail. It has to be confusing for a patient, right? They feel like they're losing their bodies. Syncope, fainting means losing yourself. So, and the patients um, um, get really confused because, okay, I'm fainting. I feel like my body's failing. I can't think. My heart's racing, and they're telling me to drink water or electrolyte beverage. And you're right. It's not all that. It's part of a soup or a recipe. So that it might be the broth of the recipe. We'll get to salt. And so it's part of the deal. And so some people may respond to water. Some people never drank water. And then you got to find that electrolyte beverage that might hydrate. And it's sort of it's like your basically your body is a big reservoir of water, mainly made out of water. And we're trying to fill up the vascular tank to compensate what's not going up vertically to your brain. You're trying to compensate to really keep that volume tank going up and keeping that you're all these patients are gravity challenged. So really trying to keep that volume much more tanked up. I know, Nick, you've been reading a lot about this. I don't know if anything you wanted to add because you've been doing some research and reading also.
Yeah, for sure. I read the same thing that Kyle kind of mentioned, that it increases your blood volume, but I was actually kind of confused when I started reading that. And I know that like a lot of the patients may not completely understand what's going on when you guys are talking about all these specifics. I just wanted to ask if you could perchance like dive deeper into that. Like, what does it mean to have high blood volume versus low blood volume?
Oh, I can jump into that one if once. So I think it's a confusing term. I'm going to say this: patients get lost in this, and medical providers get lost in this because there's a term called hypovolemic POTS, for example, which is a rare entity. And these subgroups, patients will get lost in this, and providers get lost in this because
For sure,
some
yeah.
of these patients might start out like low blood pressure, and then how the body's physiology adapts, then suddenly they're more hyperadrenergic. And the hypovolemic POTS is a very tricky one, ties in the kidney mechanism. Very few people are that way. The bottom line is this. people get lost in this hypovolemic of this. Patients respond to hydration for orthostatic issues. Fill up the tank, your blood reservoir, fill it up, fill it up, fill it up, fill it up. Find it works. Some patients have limits because they get nauseous. Nausea is a big symptom for these patients. Find a beverage that works. Some patients might have gut motility issues or stomach capacity issues that make it challenging. Find the beverage that works. Kyle, what are some of the challenges you go through with these patients about hydration?
Well, the most common one is that I don't like water. I think that's a common thing.
Yes.
I think another one is that they really struggle with the volume of water that we're asking them to drink. I mean, when you think about it, we're asking somebody to do 2.5 liters of water. That's about 80 ounces. And that's a good amount of water when you think about it. But I always encourage my patients, like, you don't have to drink it all at once. And you can take it, it's throughout the entirety of the day. So don't feel like you have to drink all 80 ounces right first thing in the morning. The other aspect is, yeah, we get a lot of patients who have nausea, gut issues. I think another one is I just feel like I have to pee constantly. People feel like they're living in the restroom because they're drinking so much water. And I think when you think about POTS, just generally speaking, they can have a lot of urinary frequency and urgency. So then you add into the factor that they're drinking a lot more water. That's another common kind of report that you hear. For me, I think a couple things, right? One, you want to make sure you get the 80 ounces or so ballpark of water if you have no fluid restrictions from any other medical diagnoses. And a nice point is a lot of patients will ask, well, like, there's times where I get really like pre-syncopal, I feel faint. There's actually a lot of recommendations that if you drink a normal sized water bottle, 500 mLs, quickly under 5 minutes, it almost acts like an IV bolus and can
Yes.
actually help with your pre-syncopal symptoms, because it will actually help naturally boost your blood pressure a little bit. A lot of our patients have a tendency, like Rob was saying, is that there's a tendency towards lower blood pressure, and that's what contributes to the lightheadedness, the dizziness, the feeling faint. So increasing that water does help with that. With that being said, though, you also have to balance that with sodium, because you don't want to hyper dilute yourself. Some people go over the top. I think I've had some patients that will say, I drink 5 liters. I'm like, whoa, like, that's a lot of water. And how do you balance your electrolytes with that amount of water? It's hard. So I think, sodium intake there has to be a balance there as
Yes.
well.
Yeah. I mean, you're right. And that's a big deal is like people want to hydrate, you can stage it. Sometimes people do more front loading the day so they're not peeing all night long. We need something to hold on to the salt, right? And Nick, you read a lot about salt and some of the powers of it, but salt can be a balancing act for some of these patients.
For sure. I like that's something I've seen in common with like all these patients, that they love salt and they just eat a lot of it and it helps with their symptoms. And it's kind of this miracle.
No, nothing's a miracle. That's the
Oh,
problem. It's a big trend. I'm gonna get into this about this. A little jump in there. I think you hit on something, my friend and colleague, is that we're at a time right now, and I think with social media, we see a lot of this. There's a lot of things out there promoting this and that as a miracle. Hydration and compression stockings and medicines or this or that, and a lot of things on the internet. There is no miracle. It's all part of a package, and there's no quick fix. People feel really bad and they want to feel better. These are young people or people in the prime of their life when they're supposed to be making money and going to school. And I get it. We all get it. And their lives are sort of happening and they want that quick fix. And I respect and the vulnerability and they want that. And there's a lot of medical predatory and people, and there's that need. They can be that way. It's part of a recipe. And I think, listen to Kyle, people got to sort of tinker around, say maybe this will be the one or this is the way to be. You got to do trial and error. Every disease state has that. Asthma, diabetes, hypertension. There's a lot of trial and error patients got to do and say, I'm going to try it this way. Sometimes sodium can also be an issue. It can raise people's blood pressure. It can cause some diarrhea for people, nausea. Too much salt can make the inner ear system more dizziness. It can cause headaches. So you got to pay attention. Is it making it worse for you?
You're right. I did get a little bit carried away there, but
No, you're good.
oh,
I think you're excellent. I don't think you carried away at all. You didn't get
mhm.
carried. It's just the waves behind you on that Zoom screen.
Adding on to kind of this discussion though, I wanted to ask you guys kind of a question that adds on to that. How can physicians like you guys help the patient choose the best at-home treatment for their own unique symptoms? Like you were saying, like salt doesn't work for everybody. Hydration, it only goes up to a certain limit. Like some take 5 liters, some can't even drink 2.5. It's very, it seems to me at least very different to each patient. I was wondering how you guys can help them figure it out. And at what point maybe you guys start recommending these type of at-home treatments?
Yeah, so I think generally speaking, right, once somebody gets a diagnosis of orthostatic hypotension, POTS, some sort of orthostatic intolerance, depending what their medical history is, right, as long as they don't have heart failure, they don't have significant kidney disease, et cetera, we're going to start pushing for them to hydrate, number one. And generally, the rule of thumb is around that 2.5 liter mark. Now, I tell this to my patients and I mean it. There's not one of them they're not all the same. So what works for Susie won't work for John, right? It's very much so different. Some patients need a little bit more, some need a little bit less. And I think it's finding that volume that works best for you. General guidelines when we give general guidelines when we're seeing those patients. So you're going to hear, generally speaking, around that 2.5 liter mark. In addition to that, we try to take into consideration like how much sodium. So you're going to typically hear 3 to 5 grams or 3,000 to 5,000 milligrams of sodium. And that also depends on, right, if you have hypertension or not. We don't want to contribute too much more to someone having high blood pressure, which is a lot. We have a good mix of hypotensive patients and hypertensive patients. So we don't want to compound an already existing problem by telling them to overdo it on the salt. And when it comes to salt, you want to make sure you're getting salt from healthy sources.
Yes.
And that's a big proponent of this is you can't just say go eat ramen noodles and Lay's potato chips because you want to make sure you're getting your sodium from healthy sources. So I'm not going to necessarily endorse one brand over another per se from a sodium perspective, but there's a lot of different sodium supplements out there. I personally drink actually sodium supplements every day. Sodium is an important part of the body. You need to make sure you balance your electrolytes. I use a brand called LMNT. I like them. They're my favorite. I truly mean it. I have no endorsement with them. I have no branding from them, but I think they're a healthy option. They give you a large dose of sodium, 1,000 milligrams in one packet, and they also balance it with some potassium and magnesium. And they don't use sugar because I think again, sourcing your sodium electrolytes is important, and making sure that you're not getting a bunch of other additives and junk with it.
Yeah, and that's a good point. I mean, I think a lot of these electrolyte beverages, you got to look at it too. Like some people do it, and some of the dyes people could be allergic to. They could feel worse. They could be migraine triggers. Too much sodium could be a migraine trigger. Kyle, you're right. And I think too is that people don't feel well, so people start to default food. You don't want to meal prep. It's hard to go to the grocery store. It's human nature. You just sort of don't want to do it because you just give in, and it's not judgment. It is what it is. So people, again, we go back to the ramen noodles or the easy foods, the microwave foods. And I see a lot of the patients, you'll see that they'll eat these foods high sodium, easy prepare foods, and they're often empty in nutrition, awfully high carb rich, and you'll feel good for a moment, and then an hour later what you'll feel is fatigue, dizzy, wooziness. And I've had some patients who I sat down with, and I've noticed that if you time your symptoms, sometimes you're feeling worse. It's because of what they're eating. I'm not saying the diet's the cause, but that's where it gets into this sort of, we're talking about salt fluid compression stockings, and it's like that life logging. People don't want to do it. And we don't want people to obsess, but pay attention. Like, hey, I drink a lot of water or a lot of hydration, I feel a little more perked up. Or if I do a little salt, I feel a little more energized, or I'm actually have more headaches, or my blood pressure seems better or worse, or if I eat this, I feel a little better, and that's where meal preps are good. And having people work with you meal prep or finding like, hey, I do better eat this every day because it has some veggies, and eat or find those things that get that nutrition. So there's some really big deals about, if you think about some of this food that store has lots of sodium in it that sits on the shelf. Some of that food's sitting on the shelf for 1, 2 years. How's that really going to be in your gut and your body when you think about it? Hmm, hmm, hmm.
Not great.
Yeah, and you look at the next organ that gets involved with POTS patients, the gut. So if something's been sitting on the shelf for 2 years, how's that going to be in your intestines and your gut? Next question, Nick.
Yeah, a few preservatives definitely don't make the stomach feel good. Let's just say that.
Or something with red dye.
Definitely
Yeah.
no. I did want to ask you guys about more like specific symptoms like brain fog, fatigue, pain. Those are like the top three that I'm doing my research on. And I wanted to see whether any of these like at-home treatments would be more effective at treating any one of those. And while I was doing my little research beforehand, I found that, well, for brain fog and fatigue, mostly the elimination of like alcohol and other stimulants like caffeine, definitely seems to help. I just did a quick Google search, so it's not like for
I
hours.
was saying one thing. The caffeine's a big deal. This supplements over the counter, some of these tablets out there have caffeine. Everyone needs to check them for caffeine in those things. It's a great point, Nick.
Yeah, and just like
Yeah,
getting
so
good amounts of sleep. Sorry, go on, Kyle.
I was just gonna say, so whenever it comes to our patients, I mean, I know this is more focused, Nick, on, hydration, sodium, et cetera, but when you really want to get into brain fog, fatigue, those aspects of things, what we put in our body makes a difference. And that is regardless of if you have an orthostatic disorder or not. If you take a normal, healthy, no diagnosis individual, and they're eating food that is heavy with refined carbohydrates, or somebody who's taking things that are eating a bunch of artificial flavorings or preservatives, things of that nature, they're naturally going to start to feel sluggish. They're going to probably start to feel more tired, sluggish. They might have more difficulty focusing, concentrating. There's a lot of data out there about what you put in your body. It garbage in, garbage out, right?
For sure.
So you're feeding your body. If you feed your body bad food, you're probably going to get bad results from how your body wants to function, right?
Mhm.
So this is where it gets hard though, because eating clean is a very expensive thing to do.
Oh, it is.
And you have to think about this when you're talking to your patients, right? Like, not everyone has the resources and the financial situation where they can easily just go out and buy the best fruits, the best vegetables, all
Yep.
fresh food. It's hard. So you have to have a little bit of like understanding and compassion to people that, some food is not going to be affordable, but doing your best to try to identify foods. And again, that goes back to the sodium, trying to make sure if you're buying something for the sodium, try to make sure it's a healthy source. And because you're just going to compound other health problems and cause those other symptoms, brain fog, fatigue, get worse. Also, when it comes to caffeine, um, I tell my patients this, I love coffee. I'm a coffee addict. And so like you don't, but coffee certainly is gonna it's a natural diuretic because of the caffeine, right? So caffeine is a natural diuretic. So you're gonna kind of be working against yourself to start your day in some ways, right? Caffeine can also be cause a little bit of vasoconstriction and maybe boost the blood
We
pressure
use
depending on
it. We use for some people caffeine to raise blood pressure.
yeah. So you could be working against yourself in some ways, but the other aspect about that is making sure you're not doing caffeine too late in the day. I think people don't always think about how it's going to impact their sleep. It also they can get the caffeine crash later in the day. So it could play a role too. You have to kind of keep that in your mind that caffeine certainly is going to maybe work against you from a hydration standpoint. And also you might get that, yeah, I feel like a burst, but then you crash. It also can make your adrenaline-like symptoms feel like they're peaking and feeling like you're more tremulous and anxious feeling. So you kind of, it affects everyone differently. Every patient needs to kind of say, how do I do with this when I take it? If I do really crummy, probably cut it out.
Yeah, well, I think it's right. I think what listening to you, Nick and Kyle, is that one thing I would say about this home remedies or home treatments, if you can, a lot of times POTS patients have felt so isolated in their care and what they've gone through, they do something very maybe not ideal. They go alone. So team up with your people in your house. Try to find someone to team up with a friend, how to meal prep or food choices, or find ways you can get food. There are grocery stores you can get food cheaper, more reasonable, or meal prep cheap. There's ways you can find things. I know there's things that we've done before that level. And Nick, you wrote something here earlier about high fiber, and there's salty snacks you can
Right.
get.
Yes.
It
Yes.
provides you have allergies, these
Mhm.
things. You want to share a little about that?
Yeah, for sure. That's actually part of the question I was going to ask you guys later about a good diet, but we're kind of already there. Um, what I was reading up on before this Zoom meeting was that a good diet, like generally, because obviously it's going to be really specific and really unique for every each and every patient that we have. Generally an increase of sodium is very good. Like we were saying, like some healthy salty foods would be like olives, pickles, nuts, or like sardines, tuna, that type of foods. And just an increase in fluids as well. And that could be like, again, we were talking about the dyes earlier, but like Gatorade or something like that, or other healthy fruit or other
Yeah.
healthy drinks.
If
Like
if find things that maybe if you like that are healthy, you're not allergic
exactly,
to,
yeah.
that bother your gut. I agree with you. And maybe find people work with you and your family and say, hey, this is something I could do that could help me.
Yeah,
and and I think like willing to venture out to see if this could work. I think it's good in that regards. And then I like what you mentioned also earlier. You're talking about this about fiber, or I mean, it comes on each person, but patients are prone to low blood sugar, right?
mhm,
Due to the sluggish guts or the high adrenaline is like, working mission of hypoglycemia, small meals, high protein. Those what Kyle said about the ramen noodles, the high carbs people eat. Really think about how you might have those aspects of things. So I think really being careful in that regards, right? I think it's a great idea.
definitely. Like I was also reading like small and frequent meals are a lot better than the large few meals. Like the three large meals a day may not be for everybody. It might be better to do a small frequent meals.
But you got to train your gut in that way because a lot of people don't feel well, so they don't eat all day long. And you got to
Mhm.
almost train your stomach and your intestines like any other muscle and say, okay, small meals, I'm going to do it this way. That's a very good point.
Large
Um,
meals take more energy to digest and they reroute the blood that could otherwise be pumping to like your brain and through your heart. They pump it down to your gut and to other necessary organs.
The one thing I want to get to too, 'cause I want about stockings toward the end, but sort of doing nutrition and home remedies. One area is important because you meant nuts and fish and people at cost, but people don't want to eat because they feel so nauseous and they don't feel exhausted. So they wait to the end of the day to eat because their energy's better and they're starving and they just grab something and they go. That's the trap of the autonomic patient. They're exhausted, they don't want to do it, and they just get something at the end of the day and then they go. That's sort of the trap of the day. But and people don't want to eat anything, so they'll eat like carbs because they're easy and they're easy to prepare and they're easy to get. You can microwave them, grab and go. And
Mhm.
people don't eat protein, but you need protein for your body function, your health. But the people that I don't want to eat that because it just doesn't feel well. The other thing is fats. You need a certain amount of fat, and a lot of patients don't want to eat fat because they're afraid of gaining weight or they're not as active. But you need fat for brain function, right, guys?
Yeah, fats are
Well,
important.
so
Yeah.
first, I think small frequent meals are good because when you do a large meal at the end of the day, especially if you do like Dr. Rob was saying, that you do like a carb heavy meal, it actually takes a lot more blood to digest that. You get more blood flow to the gut and to the stomach to help with digestion of that food, and that can make you really tired, and it can actually drop your blood pressure a little bit. We get a lot of individuals who get postprandial, post eating blood pressure dropping. So small frequent meals are going to help prevent that. Also, I mean, this is because a lot of our patients, we hear this quite often is patients feel like they they get POTS, because of POTS, they get deconditioned, they're more inactive. A lot of our patients will come and say, man, Kyle, like I can't lose, like I'm trying to get active, but I can't lose this weight. Like, what do I do? What do I do? Something that could help is like Rob said, is using like higher protein meals. Um, because protein will help kind of, number one, it's a good source of it's a good protein source. You need to have good protein for muscle growth and development, but also it fills you up. So you're not going to be naturally trying to go for snacks all night long, all day long. You're not going to be trying to be eating more unhealthy things. It'll actually kind of make you feel like you've filled up on good food. So definitely try to find good protein sources. You know, if anyone's ever looking for a good diet, um, one that makes sense for, you know, I think for POTS patients, generally speaking, would be like a Mediterranean style
Yes.
diet. You know, a piece of meat, veggie servings, and then getting your fruit too. So not necessarily many carbs in that style of a diet. I mean, carbs generally you don't have to avoid completely, but I think limiting carbs is reasonable in our patient
And
population.
it's hard because you're so right, because these patients, you can't rest and digest in a high sympathetic state. And their guts, they've not been eating, so their guts are so raw and inflamed. And a lot of times they'll eat things like a protein, and it doesn't agree with them because their guts have been so dysfunctional. And so it's like, it might not be the food, it might just be the fact that your stomach and your intestines have been so in disarray. It's not the food, it's just that you gotta start small and slow with foods. And Kyle mentioned earlier, sugar is inflammatory. It irritates the gut, it bothers the gut, it causes migraines. So a lot of times you gotta retrain your intestines again and your stomach how to eat these foods. I know we're coming down to the wire. We gotta mention those those forbidden things, compression stockings. Only 10%, in some research, 10% of people benefit from them. So anything you want to start with it, Nick? You've been doing a lot of reading about them. Are you wearing
Yeah,
them, Nick, right now?
I'm sorry.
Are you wearing them right now, Nick?
You caught me, man. Always, I always keep them on me. No, I'm kidding. I wanted to ask about them though, for sure, because I've noticed in a lot of like patient meetings I've had with you, um, that a lot of patients don't find them comfortable, but that they do
They
actually
hurt.
help. Yeah, they hurt and they're uncomfortable, and that's just like you can't really avoid that. I wanted to ask first and foremost, how do these compression stockings help? But also, I wanted to see if for those patients that find them uncomfortable, if there's any alternative that they could use. Because I know that compression stockings, like they help because they help prevent like blood pooling down your extremities, like your legs and your feet. And a lot of nurses wear them too. It's because they're on their feet all day, always moving
Yeah.
around, that their blood just pools and they can cause a clot, or it can cause it many different things. I wanted to ask you guys what you guys thought about that.
Kyle, take it away.
Yeah, so compression stockings, as you already alluded to, help push the blood back up from the lower extremities to the core. A lot of our POTS patients get what's called venous pooling. So blood shifts down into the legs. That's why they'll feel like their legs are heavy. At times they feel their legs are tingly. They can see discoloration of their extremities, purple, red, pink spotting. And so uh, tends to be worse a lot in our patients that have neuropathy, tends to be worse a lot in our patients who have hypermobile EDS or some form of EDS because of the connective tissue disruption there. And so what we've seen is, right, compression helps to push that blood back up from the legs and into the core, into the head. Now, if you actually look at the data, thigh-high compression stockings are actually the recommended treatment of choice from compression stockings, but a lot of patients can't tolerate the thigh highs because they feel overheated, they feel they're uncomfortable. Some people just feel like they're being trapped because they're just so tight, right? So a lot of times we'll compromise and say let's at least get the knee highs, but you're missing a large portion of the leg where blood can still kind of settle in the thighs. So that the recommendation is thigh high, and then if you're refractory to that, sometimes we actually use an abdominal binder to even further push the blood upward, because you can see like pelvic congestion and pelvic kind of pooling, if you will.
Yeah, I mean, you're right on, Kyle. I mean, Nick, you're spot on in your reading and your insights. I mean, they're painful, they're hot. People use them as needed. I mean, and Kyle's right. Most of your blood's sitting in your pelvic and your thigh area, so that's where it needs to be. And um, it's probably a lot of issues. Probably not enough time teaching people to use them, teaching them how to use them, and not enough people trying to use them correctly and when. It's hard. I mean, so some people might actually just use the compression leggings like you can use for workout. Some people say that works best for them. You can get them online in fitness studios, the yoga studios, those all different price tags. You can get them on the I'll say it, Amazon, and then no shameless plug, or there's more elite exercise fitness areas. People who use them have pretty good luck because they get all the way to the waist and it helps them out. And if people don't want to use them, classic things you can do is just the yoga legs on the wall. Lay on the floor, lay in your bed, put your legs up on the headboard, legs up on the sofa, and just let your blood drain that way. Or the restorative bridge pose helps too. Just do it as needed. Get the blood out of the legs. Just get that your old gravity challenge. See how it helps. Let yourself relax with the blood out. But it's a challenge. Again, building a theme. If it was all that easy, we would not be doing this podcast, right? We would not be doing this in our time that's sort of extra. We don't have this time. So I think if all this worked, that would not be research, would not be other demands. Um, it was,
Yeah, and I think, um, the other aspect is when you think about what compression is doing, right? It's helping circulate the blood back up. Another important portion of blood circulation upward is making sure your lower legs are strong, and really pushing the exercise component. I think, Nick, you were looking into that as well, right?
Yeah, before this meeting, I was looking into like what exercises can POTS patients use or patients that can't really move around that much. And I learned about isometric exercises. And isometric exercises are exercises that like contract and flex the muscle without the actual entire body moving. And it can be very useful for people with fatigue that don't even want to get out of bed, because you don't even have to get out of bed for these type of movements. You can just clench your fist like this and they get your blood moving. See how the tendons are moving, my muscles are moving.
yes,
It gets that blood flowing. And the same with squeezing your hands against each other. It's not a crazy complicated movement, and it may tire you out a lot, and that's okay, because as you do it more and more, hopefully something will change and hopefully it'll get better. And so yeah, those are isometric exercises, something that I found to be really interesting, because I thought, yeah, this is actually extremely useful for people that don't want to get out of bed, can't get out of bed, can't do much movement. And I also learned about yoga stretches.
yeah.
Dr. Wilson, if you want to jump in.
No, that's great. I love that you brought that up. Not emphasized enough. That's a great way people can do. It actually helps increase vagal tone, those stretches. Yeah. There's another thing Nick I mentioned, we have a minute left. It's called the tilt training, TILT training, where you basically have your body leaning against the wall. The only thing that's touching is the back of your head and your shoulders. And that really trains your body, your baroreceptors, how to learn how to be and how to learn how to handle the orthostatic issues. You're supported, but it really gets all the centers primed and how they push the blood back up. That's a sort of daily exercise to retrain things. That's a great point.
Yeah,
And,
definitely.
and also too, I mean, you don't need a gym to exercise, right? I mean, you both have already alluded to that. There's so many body weight exercises that individuals can do to strengthen their legs, whether you're on the ground or whether you're able to stand up, or even using like chair poses or chair yoga. I
Yes.
mean, there's so many different things you can do, because I know patients always get a little bit nervous about, I feel faint, I feel dizzy, I feel like I could hit the ground. I don't want to be doing things that could put me in danger. You can lay down and do these exercises to strengthen your legs and strengthen your core. So there's a lot of options available to there, and I think looking up those type of floor exercises, there's things. I know Rob actually has a different channel, because he's really here to support all of you, and he has a different channel where he actually does exercises for people and gives demonstration. So there's a lot out there where you can find a resource for this.
Yeah. Yeah. Thank you, Kyle. I know we're coming down to the last minute, so let's do a little wrap up here. I want to thank both you guys. We're much more of a serious tones, a somber tone today, which I think is
Yeah, we
good. We
kind of
care
jumped
about
right in.
everybody and that level. So Nick, we have a minute left. I'll let you wrap it up a little.
Yeah, so I know we kind of jumped in today, not much of an introduction, but I just want to thank you guys for listening. I want to put an emphasis on your mental health. That's like above
Mhm.
all, keep that up, please. Please maintain hope. I know I touched on that in the previous episode, but I believe it. Personally, I believe it's the most important thing. And
And Nick, on that point, you're right. All the wellness stuff, if you're not in a good place in your head, and sometimes you can wake up and just be totally sideways with the world and yourself, and none of the stuff we talked about can matter. So, mercy for yourself. Well
yeah,
said, my friend.
definitely.
All right,
Well,
we'll end on that note. That's a key point. I think it's a really good point. Mental health is everything.
yes. And maybe we can touch on that in a future episode.
Oh, I agree. I think we
Yeah,
have many episodes. It really is a huge thing. We should end on that note.
for sure.
All
All right.
right, guys. Peace out.
Thank you for watching. Peace out.
Take care.
Bye bye.
Thank you for listening.